Rwanda has made great achievement in reducing maternal and newborn death, and we've been focusing on infectious disease for the last years. But today we realize that as many countries, non-communicable diseases are rising, including cancer. We were honored to meet BioVenture for Global Health. We initiated a partnership with them, and we hope that this partnership will open doors to the government of Rwanda.
Africa is on the brink of a cancer epidemic and crisis. Today, cancer kills 60% more Africans than malaria, and yet only 5% of global cancer resources target low and middle income countries. To address this growing cancer crisis, we need new and innovative partnership models that focus on the priorities of Africans, and we urgently need to mobilize domestic and international resources.
We are facing what we call epidemiological transition. With the increase in the incidence of non-communicable disease, such as cancer, many African countries are not prepared to face the burden of non-communicable disease. So it's important now to act against this.
In 2017, BVGH launched the African Access Initiative, or AAI, an innovative and first-of-its-kind public-private partnership model that begins by looking at each country's national cancer strategy and plan and its cancer hospitals. Through AAI, BVGH engages stakeholders across sectors to accelerate and mobilize access to prioritized cancer treatment. AAI includes expanding access to cancer medicines and technologies, strengthening laboratory and healthcare infrastructure, and building clinical oncology and research and development capacity. Most importantly, AAI is built on the priorities and needs defined by African clinicians and ministries of health.
The problems in Africa related to health and specifically cancer are enormous, and they cannot be addressed just by one institution or one company or one industry. It really needs to be a corporate effort between government, civil society, academia, and pharma companies. And each of us have specific expertise that we can bring to bear, and it's only by working together that we will get anywhere in solving this problem.
The objective of BVGH in introducing AI and the way they intend to make that happen by putting together partnerships, sustainable partnerships between government, between academia, between the clinicians, and a sustainable way of making access to these medicines possible.
Driven by Africa for Africa, AAI uses data generated at the country and hospital level, with African oncology teams completing a detailed hospital needs assessment or questionnaire. All AAI program activities, including capacity building initiatives such as equipment donation, placement and training, fellowships, and creating new access models for drugs and technologies, focus on and match the priorities and needs identified in each hospital's AAI needs assessment.
Organizations that partner correctly and effectively with African organizations are the ones that are going to have the best opportunity to address African needs and serve African needs in this very growing and economically vibrant setting.
We need to listen to oncologists in Africa. They know what is needed, and so we need this sort of collaborative approach and bring different groups together because they all bring different ideas and solutions.
AAI is the right solution at the right time, building partnerships based on mutual respect and understanding, and with a shared investment and commitment and sense of urgency across partners is a model that has proven to be successful.
So partnering with BVGH on the African Access Initiative has been critical to allowing us to meet those goals, to build capacity quickly, to look at novel models for making medicines accessible in sub-Saharan Africa, and to do that in that partnership model very quickly, very meaningfully.
Nous pouvons, avec les professionnels de la santé bien formés, faire le diagnostic précoce et rendre accessibles les traitements aux patients pour améliorer la mortalité du cancer en Côte d'Ivoire, qui aujourd'hui est dramatique parce que 20% seulement des patients sont vivants à 5 ans, tout cancer confondu.
AAI was created to provide sustainable and safe access to cancer medicines and technologies. With 5 African countries and more than 30 cancer-treating hospitals on board, AAI is poised to have an important and lasting impact, on cancer and patients in Africa.
You know, a lot of people get saddened by the word C. They don't want to hear about cancer. But there are lots of good stories about patients surviving cancer, getting back into their community and living strong, even becoming better people as a result of having been touched by cancer. So what I'm looking for are more survivors on the continent who are going to tell the story of surviving a difficult and challenging moment in their lives and then giving their lives to support other people.